Whether you're a clerk or a waiter, an accountant or a doctor, your health matters.
Zambia, rich in natural and human resources, is making giant strides in economic growth, transforming its landscape and providing huge opportunities for its people. But in spite of all these gains, Zambia is burdened by huge and diverse challenges: HIV/AIDS, tuberculosis, and malaria, in addition to other illnesses. But it is malaria that has imposed greater social-economic burden. It is a major public health problem.
If we look at the year 2012, we had a total of 4,800,000 cases of malaria, both confirmed and clinical cases. And in the same year, we had actually 3,800 deaths. So malaria is still a big problem, and there's a lot of effort that has to be put in to ensure that we're able to bring the deaths to zero, if we can manage that. That is our vision, to try and bring down the deaths to zero, and even eradicate malaria by the year 2030.
Zambia is fully committed to meet this challenge. The enormity of the problem is drawing deserved attention to one of Zambia's largest health hazards. And the battle against this dreaded disease is now a larger priority. Over a period, with the support from cooperating partners, Zambia has put in place strong policies and specific control actions and measures to stem the spread of the menace of malaria.
National Malaria Control Center has been implementing malaria control interventions for, I think, since 1998, when it was made a statutory body under the Ministry of Health. We've seen a significant decrease in number of malaria cases recorded. And from 2000, we've seen over 50% decrease in the number of cases recorded at health facilities. We've also seen over 60% of decrease in number of deaths recorded in the health facilities. So all in all, we've seen a significant decrease in malaria cases in Zambia.
Although malaria is a preventable and treatable disease, it still remains the #1 health concern in Zambia, along with TB and HIV/AIDS, stifling prosperity and economic progress in all sectors. The vision is a malaria-free Zambia. In pursuit of this vision, the country is committed to successfully combating and eliminating malaria through the introduction of efficient management at the local level.
We, as a National Malaria Control Center under the Ministry of Health, have got a vision that by 2030 we should have eradicated malaria from Zambia. So we are moving towards that direction. It is something that is achievable, and we shall be able to do it.
One such district implementing these new strategies in malaria prevention is Iteji. In addition to the already existing malaria preventive activities, such as the distribution of insecticide-treated mosquito nets, ITNs, case management, indoor residual household spraying, and the intermittent preventive treatment, IPT, which is given to pregnant women, Iteji district has taken a step further to address the malaria prevention activity at community level, using community-based agents trained by the district in partnership with Across Research. Facility malaria-based agents are trained in detecting cases at community level and then reporting those cases to the district and finally to the Ministry of Health. This has resulted in a significant drop in the number of malaria cases and the number of patients who die as a result of malaria.
With these interventions that have been put in place, we have realized that there has been a lot of benefits that the district has recorded. In the first place, I would mention that of late, the malaria incidence has reduced If we compare 2012, the malaria incidence was at 9.6 as compared to the malaria incidence in 2011, which was at 9.8. So this reduction has been attributed to the effective implementation of malaria community-based prevention activities.
With all these interventions we are deploying, the traditional ones, the indoor residue spray, the use of long-lasting nets, the IPTP, that is the intermittent preventive treatment, with the new initiatives I've just spoken about, we think it's possible to eliminate malaria in Zambia.
Whether you're a clerk or a waiter, an accountant or a doctor, your health matters.
Hello and welcome to the first in the series, Your Health Matters, Let's Talk. Your Health Matters, Let's Talk is a program that focuses on principal health issues affecting us in our day-to-day lives. On the program today, we are discussing malaria, the case management of malaria. Help me welcome in the studio my guests on this episode. Dr. Mulakwa Kamulio is Deputy Director, Disease Surveillance Control and Research at the Ministry of Health. Next to Dr. Kamulio is Joyce Shawalupia, a community health worker at Kampekete Health Center in Chongwe District. In the clip that we just saw, malaria comes out as rampant in Zambia. I would like to find out, Doctor, I'll start with you. Is the situation on the ground that bad? Is malaria really a problem in this country?
Malaria in Zambia is still a big public health concern. Malaria is present throughout the country. In some areas, the transmission is very high. But in some areas in parts of Zambia, the transmission of malaria is very low. For example, in the northern part of Zambia, the eastern part, the northwestern part, the burden of malaria is high.
What would you attribute that to? Why is it that the transmission of malaria in Lusaka is low, and in the other parts of the country, like you did mention the northern province, the transmission is quite high? What could be the...
For centuries, we've known that malaria is a disease of the rural. The reasons being that there are geographical and climatic conditions which favor the proliferation of malaria-carrying mosquitoes. In urban areas, you realize that you may not find a lot of streams or pools of water compared to the rural area.
Let me turn to Joyce. I know that you're from Kampekete Rural Health Center in Chongwe. How are you dealing with malaria on the ground? Based on what the doctor has just told us, that malaria is a problem of the rural. You must have a lot of cases, to do with malaria.
In our community, we do most of the project of prevention. So we do health talks and health talks mainly.
Mm-hmm. Doctor,
yes.
Is malaria preventable?
Yeah, malaria is a preventable disease. The best way and the most effective way to prevent malaria is to prevent from mosquito bites. This can be done either through the use of a mosquito net. We now use long-lasting insecticide-treated mosquito nets, meaning the mosquito nets are now treated with chemicals that can kill the mosquito.
I know that malaria symptoms mostly mimic symptoms for other diseases. How do you tell that now what I have is malaria, or this is just a simple flu, or this is just a headache, or I'm just stressed, or I'm tired? How can you distinguish?
Yes, you're correct. Malaria as a disease mimics many other illnesses. The symptoms are similar to many illnesses, illnesses like the common cold. However, the commonest symptoms of malaria include fever or body hotness, if you like. It includes vomiting, joint pains, backache, headache. Sometimes patients may present with diarrhea and coughs. Malaria can also progress to complicated malaria. And the complicated malaria include, the symptoms include very high fevers, excessive vomiting, drowsiness, loss of consciousness, and sometimes fits. In severe malaria, you can also have severe anemia. That means having low blood levels, developing yellow eyes, commonly called jaundice. Also, sometimes severe malaria can affect your kidneys. That means you produce very little urine and little quantities.
Interesting, very, very interesting, especially on the severe vomiting, because some women might think when you're vomiting and you have temperature, the first thing that comes to most women is maybe I'm pregnant. They think of malaria much, much later. Isn't that the problem? Isn't that the situation, Joyce?
It is.
It is on the ground, right? So it is, like you're saying, it's very important that when you feel any of those symptoms and the fact that malaria mimics a lot of other diseases, you rush to the clinic. Joyce, I want to find out, when you're doing these sensitization programs with the communities, what do you tell them? Like, for instance, if you have one of the symptoms that the doctor has just mentioned, what should one do immediately when you feel any of the symptoms that the doctor has just alluded to?
Okay. In the rural areas, we have these community health workers. We always educate them. When they see these symptoms, the first thing they should go to the community health worker and rush to the clinic. And the duties of the community health workers is, one, to test whether that is malaria or it's just a fever.
So is it allowed to give medication based on the case history? Because I know that when you go to a doctor, he will first find out from you, how are you feeling? How long have you been feeling like this? And are you vomiting? Are you not vomiting? Are you cold? And what? And so at what point should a person start getting treatment?
We give medication when we test the malaria test positive. When it is negative and the patient has signs and symptoms of malaria, we always refer to the clinic.
Doctor, how critical is the malaria test?
Testing for malaria is important. And we always encourage our health workers to test before they give medication. Treating patients starts from talking to the patients, that means getting their history. When malaria is suspected, a test is done. You can do the test using a rapid malaria diagnostic test, or you can use a microscope. That means taking a blood slide and being examined in the laboratory. When the test is positive, that's the only time you can prescribe an anti-malaria medicine.
So what happens if you don't get, you don't detect malaria early, and secondly, you don't start getting medication early for malaria? Give us a scenario of what could happen if such a situation was to occur.
When someone or a person has got malaria and they are not treated early, the disease may progress to severe, sometimes called complicated malaria. So it's always encouraged when one suspects to have malaria or have symptoms of malaria to seek treatment early from a health center or a clinic.
So how early is early?
We always encourage patients who suspect to have symptoms of malaria to present to the clinic within 24 hours of onset of symptoms. Thereby you would reduce the chance of the disease to progress to severe malaria.
Okay, so I really want to get an idea of what would happen if I don't go to the clinic within 24 hours and I have these symptoms which I might think are not malaria related. What could happen after 24 hours?
Malaria is essentially is a life-threatening disease. If you like, you can say it's a potential fatal disease. If treatment is not sought early, or treatment is not commenced early, within 24 hours it can go into severe malaria, and thereby can lead to death.
Just like that?
Yes.
Joyce, I know that there are misconceptions when it comes to malaria, and you are on the ground. You are dealing with malaria on the ground. What are some of the problems that you face when you're talking to people about malaria, or someone is sick, you want them to take medication, prescribed medication, and they don't do that? Just run me through some of the issues that you face with the community, the problems.
Okay, the problems we face in the community are the underdose of treatment. When the patient takes Coartem for first and second dose, that patient will feel better. And many of those patients, they stop taking the drugs. And the other point, maybe it's they don't just want to go to the clinic, they use these herbal drugs.
So what are the consequences if I stop my malaria treatment halfway? Doctor, is it as bad as not taking medication at all if you cut your medication of malaria?
If you do not complete your course of treatment, the illness may come back. Secondly, you are encouraging, if you don't finish your treatment course, you are encouraging the parasites to become resistant to the malaria medicines, so much so that the medicines will stop being effective. It means patients may not be getting better after the treatment, they take the anti-malaria medicines.
Now, Dr. Joyce did mention a very, very critical issue, and this is the use of herbal medicines, traditional medicines in handling cases of malaria. Is that advisable?
Yes, there have been reports of people in the communities using herbal medication to treat malaria, but it's not advisable to use herbal medication. Of course, there are some herbal medications which are believed to have properties of anti-malaria medicines, but this is not advisable. I would discourage our communities to use herbal medication to treat malaria.
Thank you. Still on medication, some health workers have continued prescribing Fansida as a form of treating malaria. Is that correct?
The practice of using Fansida, in medical terms we call it sulfadoxine pyrimethamine, it's not advisable for the simple reason that Fansida is no longer effective in treating malaria. However, we use it in prevention of malaria in pregnancy only. So we are using it as a preventive tool, not for treatment. So we would discourage our health workers not to prescribe Fansida for treating malaria.
What kind of advice do you give people when it comes to management of malaria before someone even goes to the clinic? What should they do?
I think at home, like many other illnesses, if you have symptoms related to malaria, you could probably take Panadol. Probably Panadol will reduce body pains, will reduce a headache. It will also bring down the temperature or fever. Thereafter, I think every effort must be taken to seek advice from a health worker who would discourage to self-medicate. That means you go to an outlet where medicines are sold and you buy and you treat yourself. That's discouraged.
Doctor, I know that there are a lot of preventive measures that are being done at a local level, at community level, and even as a nation as a whole. Would you like to shed more light on that, to give us hope in this fight against malaria?
Yes, there's hope. We are very optimistic that in the coming years, Zambia shall be free of malaria with the right policies, with the right interventions, which we have been implementing for years, with a political will, with commitment from the health workers, and with dealing with the informed community, malaria can be defeated. So there is hope.
Doctor, I would like to thank you so much for sharing this critical information on malaria. And Joyce, thank you for sharing with us the experiences on the ground on how you're dealing with malaria. It is now time for questions. This is the time that we've all been waiting for. I know the audience is excited because I can see a lot of hands and a lot of enthusiastic faces there. Thank you very much. So who starts? Right, this is really exciting. The lady at the back, please.
Thank you very much. Hello, my name is Albertina, and I'd like to know how malaria is managed in pregnant women.
That's a very important question. Let me start by saying that we are all at risk of having malaria. However, children under 5 and pregnant women are more vulnerable to develop malaria. For a pregnant woman, if they have symptoms related to malaria, they are advised to seek early treatment. That means they go to see a health worker. A history will be taken, they'll be examined, and a test will be done. The test will be done by either doing a rapid malaria test or doing a blood slide, and then that blood slide will be examined. If the test comes out positive, they'll be given an anti-malaria medicine. Now, let me make it very clear. In pregnancy, 2 types of treatments are given depending on the stage of pregnancy. In the first trimester, that is the first 3 months of pregnancy, if a woman tests positive and is simple malaria, we'll give quinine tablets. That's to be taken by mouth, or we call it oral quinine. If a pregnant woman tests positive after the third trimester, that means after the first 3 months of pregnancy, we can give Coartem. It's safe to be given Coartem. For severe malaria in pregnancy, like any other group, the treatment of choice for severe malaria is quinine, and that's given through a drip. Thank you.
Thank you so much, Doctor. Let's get the next question. That was a very, very interesting question, and I like it. I'm sure all the mothers out there and all the pregnant women have got 1 or 2 important points. Let's get the next question, please.
I feel uncomfortable sleeping under a mosquito net.
You're not the only one.
Suffocated.
You're not the only one.
I wanted to find out from the doctor if you can really breathe properly when sleeping under a mosquito net. Thank you.
That's a common problem, Doctor.
The use of a mosquito net is one of the recommended and most important preventive means. I know some people believe that once they sleep under mosquito nets, they get suffocated. That's a common problem, but let me make it clear that it's a misconception. There's no truth in it. I would call it just a psychological feeling. I do sleep in a mosquito net, and I don't feel suffocated. So I would encourage our communities to sleep under mosquito net.
Well, thank you, Doctor. Audience, you've heard it for yourselves. You can sleep under a mosquito net. You won't die. It is safe. He's assured us here. But how do I get over that psychological fear of using a mosquito net?
I think consistent use of mosquito nets will take away your fear. As I said, it's a psychological fear.
Let's get some more questions. Wow, I love this. The gentleman at the back.
Hi, Doc. My name's Muma Michael Kawele. I experienced a high fever and a bad headache. I went to this particular clinic. This health worker went on and gave me a medication for malaria, but without a malaria test. But is this what should really happen? Thank you.
We would discourage our health workers to give treatment before testing for if malaria is suspected. Malaria symptoms mimic many other diseases. So if a test is not given, a wrong medicine can be given.
Okay, let's get some more questions. The lady at the back.
Doctor, I have a concern. What medication should be prescribed for the treatment of malaria?
Please let me emphasize that we no longer use chloroquine for treating malaria. We no longer use Fansida for treating malaria. So for simple or uncomplicated malaria, the treatment of choice is Coartem. For severe malaria, the treatment of choice is using quinine. This is true for children as well.
Wow, I'm loving this. So many questions for you, Doctor, but thank you for being in the studio because you'll be able to answer all these questions. The lady in black, please.
Thank you very much. My name is Felicity, and my question is, why is it that the malaria test results come out negative even when you show all the symptoms of malaria and then you're able to respond to treatment? Does it really mean that you had malaria?
That's a very important question. If a blood test is done for malaria and it's negative, most unlikely you have malaria. However, if you are giving anti-malaria medicines and then you respond, that may not mean that you've got malaria, because there are some illnesses which are self-limiting, like a flu. If you had a common cold and you took an anti-malaria medicine, eventually you may get better, and you thought you took anti-malaria medicine and you got better. So we will always encourage to treat malaria when the blood side is positive. Thank you.
Perfect. Some more? Yes, the gentleman in front here.
What are some of the complications of malaria if not treated in good time? Thank you.
If malaria is not treated in good time, that it's not treated early, it can progress to complicated malaria, or sometimes called severe malaria. And if a patient is not treated, they could die.
Remember, malaria can be defeated with the right information and following instructions when taking medication. Audience, did you have fun?
Yes.
Did you receive it?
Yes.
Well, that's it. That's the program. Your Health Matters and Let's Talk. Until next time at the same time, God bless you.
This program is brought to you by the Ministry of Health with support from the United States Agency for International Development and its Communication Support for Health project.